And I think it taxes too much, it puts too many regulatory burdens on the healthcare system, and it doesn't solve the cost problem, which is critical at this particular time given our deficit. So I think we need to start over with a more sensible, cost-effective plan, and so repealing and starting over is the best option. Well, Indiana is pretty severely affected, as the governor has outlined. First of all, a Healthy Indiana plan that the governor put in place is a cost-saving, innovative plan developed at the state level. The federal plan usurps all this and takes it away, and instead of saving money and providing health care for people who need it at a reasonable cost, they now are dumped into the federal system. And it's just one example of what's wrong with this Obamacare plan. Secondly, we're probably the leading device manufacturer in the country. Our device industry creates a lot of jobs in Indiana. We export overseas. That's healthy for our budget. And yet their imposed tax had nothing to do with their engagement in health care. It was just simply deep pockets. Let's tax somebody. $20 billion tax over 10 years. Adversely affects hiring and jobs and creation and production of new medical devices. Well, you know, we're going to make every effort we can on repeal because I think starting over is the best way to do it. If we fall short of that, and we probably will because the president said he's not going to support what we do, we're going to take specific pieces of that. We've already offered an amendment on paperwork problem that the bill creates. There's a number of other things that I have co-sponsored. One by one, we're going to point out the parts of the bill that I think are egregious, they're not cost-effective, they are regulatory stifling, they kill creativity and innovation within the healthcare industry. We're going to point those out to the American public. We're going to have a vote on it. Hopefully the president will accept some of that. He said he wanted to work with us. We'll see. Well, you know, the case in Florida was very well written, and I think it made some very persuasive arguments for the unconstitutionality of this health care bill. I'm hoping the Supreme Court will uphold that case. I think there are good grounds to do so. It may come down to one person. Some say that the court is divided 4-4 on this, and Justice Kennedy might be the deciding vote. But I was encouraged that that Florida decision might be the kind of the central argument against this health care bill and the unconstitutionality of this. The judge there said that we could take the bill down on the basis of this. That would give us the opportunity to start again, which I think is the most constructive thing to do. We do have a health care issue and problem, and I've outlined a number of proposals as a way to address that problem, but at far less savings and far less government intrusion than what this bill has.